I'm Mark Bailey, joined today by Dr. Jorge Porras from eStudySite.com, and we're talking about the fastest growing segment of the American population, the elderly. And Dr. Porras, today we want to talk about what happens to sleeping patterns in the elderly, and particularly insomnia.
Right. Well, insomnia, first of all, is a sleep condition that's really defined as difficulty falling asleep, difficulty staying asleep, or not getting restorative sleep, and to the point where you have difficulty functioning. And as we age, the brain ages, and it's found that the elderly sleep lighter, and they wake up more frequently, and as a result, they're less efficient in their sleeping. In other words, they're in bed a lot, but they're not sleeping as much as they used to.
So now, I had always understood that as you age, you don't need as much sleep. Is that not true?
That is not true.
Oh, okay.
What is known is that we found that healthy elderly people don't complain about sleep problems. It is people who have some medical problems, maybe some medications that they're on, stress as they get older, that results in sleep problems.
So insomnia can actually be an indication that something more serious may be going on somewhere in the body, and that becomes a medical condition that really needs to be looked after.
Exactly. Medical problems such as hypertension, cardiovascular disease, things like that. And one that we worry about as well is dementia. Many people who have sleep problems often start having symptoms of dementia that can really be insomnia. So as a consequence, when you don't sleep, as you might guess, you're not as sharp as you usually are. Your memory isn't as sharp. Your ability to do tasks on a daily basis starts to decline, and that looks a lot like dementia. But if you're looked at in a very comprehensive manner, it might turn out to be insomnia.
Could be insomnia. And there's new medications all the time.
Right. This is an exciting time for the CNS part of research now. A lot of new medications are coming out in the pipeline. We know that elderly people have a risk for falls and things like that we don't want. With the older medications for sleep, they used to really even be toxic to the elderly.
Right.
Now, the newer medications are much more benign and help you sleep without that grogginess the next day.
Now, I know folks are going to want more information on this. Is this also something that lends itself to clinical trials?
Yes, especially with the elderly. Not enough is known about the elderly and their sleep, and anybody that's willing to go into a clinical trial, that type of information is very vital.
Beautiful. Well, if they'd like more information, they can certainly call the number that's been on the screen, or they can go to eStudySite.com. Dr. Jorge Porras, thank you.
Thank you.